This article was published by the Australian Endodontic Journal in 2023 by a Brazilian group. The title of this publication is Analysis of Obtaining Apical Patency Indexes During Endodontic Treatment Considering Gender, Age, Pulporadicular Diagnosis, and Canal to Tooth, a Clinical Study. This clinical study aimed to perform analysis of obtaining apical patency indexes during endodontic treatment considering gender, age, pulporadicular diagnoses. As a null hypothesis, it was considered that age and gender and pulporadicular factor would not influence the obtaining of apical patency. Necrotic teeth, an necrotic teeth, and an endodontic infection can spread to the apical foramen, reaching the periodicular tissue and external root surfaces. Complete elimination require endodontic surgery. However, when an infection is considered to the apical foramen, maintaining apical patency supports the disorganization. Promoting the repair process, numerous authors considered apical patency a crucial factor for the success of endodontic treatment. So in this study, 383 patients participated. The study conducted at the School of Dentistry in Brazil between 2015 and 2017 involved an endodontic treatment of 639 canals. The diagnosis of the teeth was determined through clinical examination, cold thermal pulpal testing, and digital radiograph or parallel technique. Based on these examinations and tests, the teeth were classified as either vital, necrotic, with or without preapical lesion. Based on their exams, the only exclusion criteria from this study is the preapical lesion present only in one or two roots and a vital and necrotic canals in the same multi-rooted tooth. So this is the only exclusion criteria. During endodontic treatment, the clinical procedure itself, after administrating of the local anesthesia, the rubber dam, and also the access cavity preparation of the orifices, different sections of the tooth was done using specific drills. Sodium hypochlorite was the irrigant of choice with a different concentration for vital and necrotic teeth. Of course, they used electron apex locator and a radiographic examination to confirm the patency of all of the cases. And then they recorded all the data on an Excel sheet. For the statistical analysis, the data distribution was initially examined using Kolmogorov-Smirnov test. Once it was confirmed that the data followed a normal distribution, further statistical analyses were conducted using software. These analyses included the chi-square test and z-test for comparing proportion between the variables to account for multiple comparison. A Bonferroni correction was applied. The significance level test was set. The findings for this clinical trial, both age and gender variable, did not show any significant statistical difference in achieving patency. The non-achievement of apical patency was significantly higher in root canals of vital teeth, 14.6% out of 178%, as you can see in table number 3. The only variable significantly influence the rate of obtaining apical patency is the canal to root variable, which is in the final table, as you can see. Of course, in this study, apical patency was successfully achieved in 89.7% of the evaluated canal. The achievement of apical patency was not influenced by age or gender. However, the foraminal axis was found to be more difficult in vital teeth in a specific canal, such as the distobuccal canal of the maxillary first molar, the mesial canal of the mandibular first molar, and the mesobuccal canal of the mandibular second molar, and the buccal and the palatal canals of maxillary second premolars. And lastly, the buccal canal of the first maxillary premolar, as you can see in the statistics.